Is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
The most miserable time. My eyes get swollen, puffy, red, glassy. They're a little bit like that right now.
Allergies. Millions of us suffer from seasonal or food allergies. What causes them? What treatments are available? Today, we hope to answer these questions and much more. Welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. If you're watching us live now and you have questions concerning food or seasonal allergies, our operators are standing by to take your calls. Your questions may be answered here live on our program by our experts. The experts answering your questions today are Dr. Maya Jarath, the director of UNC Allergy and Immunology Clinic, and Dr. Richard Jones with Man, Ear, Nose, and Throat Clinic. To call us here at Rex on Call, just dial that number on your screen. In Wake County, call 919-744-3876. Outside of Wake County, toll free 877-277-6252. If you're watching us as we're streaming live on WRAL.com, you can email us your questions, rexoncall@rexhealth.com. You can even find us on Twitter. Send us your questions at Rex Healthcare. Use the hashtag RexOnCall. Now, if you suffer from seasonal allergies, this spring could be a doozy. Because of our wicked winter, doctors are predicting a more active allergy season. Here's an explanation and some treatment options.
Our long, cold winter is still causing problems. Even though the snow has melted, the consistent wet weather may mean a more intense allergy season.
Unfortunately, because of the long winter, there was some snow, some ice. What that results in is a lot of mold that's going to come up.
For Courtney Bowman and millions like her, the symptoms are in full swing.
Itchy eyes, runny nose, stuffy nose, sneezing.
She's resorting to allergy shots at Capital Ear, Nose, and Throat in Raleigh. Dr. Javeen Ramakrishnan tells us how they work. First, there's testing.
Apply a very, very small amount of different types of allergens into the skin, and we check how your skin reacts to that, and that tells us if you're allergic to a particular allergen, and if you are, how allergic you are.
Then you're treated once a week for 10 to 12 weeks with shots.
Giving a very small dose of what you're allergic to into your body, and what that results in is a desensitization of your body to those things that you're allergic to.
It takes a little time to build up the immunity, so I'm hoping that will be my answer.
Until she can find relief, Courtney is following some of Dr. Ramakrishnan's other advice. Washing sheets in hot water, putting dust mite covers on beds, avoiding keeping any plants indoors, and avoiding areas with excess moisture like basements. Still, she knows she just has to wait until pollen season passes.
This is the most miserable time. My eyes get swollen, puffy, red, glassy. They're a little bit like that right now.
Gotta love pollen season. Joining us now, Dr. Maya Jarath, the director of UNC Allergy and Immunology Clinic, and Dr. Richard Jones with Man, Ear, Nose, and Throat Clinic. Thanks, guys, for being with us. I know this is a hot topic. Everybody's talking about it. So let's start with this. How do you tell between seasonal allergies and what could be a cold?
In the winter, a cold is going to often be accompanied with a fever. As you move into the spring season, you'll see similar symptoms with the runny nose. Again, perhaps a lot more itching without the fever. And so the duration of the symptoms and the characterization of the symptoms is important to sort of separate out. But most colds are going to be accompanied with that fever.
Okay, and last for what, like a week? But if it goes
7
longer
to 10
than that,
days, yes.
Okay. And so talk to me about some options for children. We already did get a question in about, I think my 5-year-old has allergies. What are some treatment options for kids?
Well, in addition to oral antihistamines, most of which are available over the counter, you can also do intranasal sprays, and they come in steroid form, which is anti-inflammatory medicine, and then also nasal antihistamines for older children are available as well. And then, of course, as was alluded to earlier in the program, there are allergy shots, which can be offered for children as well as adults.
Okay, and I know, so you do the sublingual,
Yes.
so you offer allergy shots, and you offer, so tell us what you see as the benefits of the sublingual application.
The sublingual application, again, gives you the advantage of just not having to get a shot. The disadvantages are it's an everyday treatment. You do this every day yourself at home, but obviously with a 5-year-old child, they might be on board with putting some drops under their tongue more readily than coming to the office every week to get a shot.
Okay. Now, and we had talked about, and this is something I'd never heard of, an allergy to red meat.
That's right.
Yeah, so talk to us a little bit about that and what some of the symptoms are.
Sure. So this is an allergy that we've learned about only in the last 5 or 6 years, although the allergy itself is probably a lot older. And in this, people have symptoms of an allergic reaction. So they break out in hives, develop itching, can develop stomach cramps, and in the worst case can go into anaphylaxis, so their blood pressure falls and they can pass out. And this happens 4 to 6 hours after eating red meat, so meat such as beef or pork.
So not right away, like a nut
right away.
allergy.
Right, and that's what's different about it.
Okay, and do you find that a lot of people they confuse that with some sort of, a digestive type of issue?
Yes.
Yeah.
Certainly.
Yeah, that's a new difficult topic. That's like, say, it's very characteristic though. The reactions are, again, very delayed. 3 to 4 hours later is when the patient experiences symptoms. And so again, they have to really think about what did I just eat?
Right. And that, I think, is what's made it so difficult for us to recognize this allergy, the fact that it is so delayed, because most people are not thinking about what they ate 4 to 6 hours ago. And the other thing about it that's confounding is that it doesn't happen each and every time you eat red meat.
Wow.
So you could eat a hamburger today and be fine, and then could eat it tomorrow and have this reaction. And so people often say, well, it can't be the hamburger because I know I ate that yesterday and I was okay. And those two things together have made it very hard for us to come up with this diagnosis.
So how do you diagnose it?
There's a blood test for it,
Okay.
and so based on the clinical history and the blood test is how we make the diagnosis.
Okay, we also got a question about adult onset food allergies, and I have a question about that because I have developed a recent allergy to nuts just in the past few months. How does that happen? I've been able to have nuts my entire life. I mean, what happens?
Well, we do, you can develop an allergy at any age. Food allergies are much more common in children than they are in adults. Mm-hmm. So the incidence is higher there in that population. And many food allergies in children are actually outgrown. Nuts, unfortunately, is not one of them. But you can acquire allergies at any age. I've had patients with new onset allergies in their 60s. So, your immune system is constantly reacting to the environment around it, and it can come on at any time.
Okay, and what have you seen? Has this winter, we were predicting, or folks were predicting that this, because of the winter weather, that this spring was going to be worse, but we've had some rain, so how has it been? Is it better,
I don't think
worse?
It's been as bad this year as in some previous years lately, but the season's not over, but it's coming in, I think, a little slower.
Oh, and also, you were saying that the yellow stuff that we see on our cars, that's not the stuff that gives
That's
us bad
usually not the bad deal. The bad deal is much more microscopic, and you can't see it in the air. The stuff that falls to the ground is on the ground.
Yeah, and it's not a problem even if it's like raining yellow from the trees.
Correct. The particles are too large to really penetrate and go deep into your lungs, so sometimes they can cause eye symptoms, but they rarely cause, lung symptoms. But what comes down at the same time is the yellow-green stuff you see on your car is pine pollen, and what pollinates at the same time of the year is oak, and that's what's causing most people trouble at the time when the yellow stuff is out.
Okay, great. And I hear the phones are very, very busy, so we're gonna get to some of those questions right after this break. So give us a call now in Wake County, 919-744-3876. Outside of Wake County, 877-277-6252. You can email us your questions at rexoncall@rexhealth.com. Tweet us your questions at RexHealthCare, #RexOnCall. We are back after this break to answer your questions. Stay with us. Welcome back. This is Rex on Call live on WRAL. Today we're answering your questions on allergies, everything from peanuts to hay fever. Now, earlier this month, the FDA approved the first tablet for gradually reducing hay fever symptoms as an alternative to allergy shots. It's called Orlair, and it's been approved for patients ages 10 to 65. Orlair tablets are taken daily starting 4 months before grass pollen season to reduce allergic reactions to the 5 most common U.S. grass types allergies. So we've talked a little bit about this. So that those would be the tablets you put underneath your tongue, and that's just for grass.
That's right, although actually just a few days ago, the FDA also approved a tablet for ragweed.
Okay.
So there is treatment for that as well, and that may be more relevant this year because, as you said, these tablets have to be started a few months before the season, and the grass season is already upon us. Ragweed season is yet to come, so this would be a time to start ragweed therapy.
Yeah, and easier and more comfortable than shots.
Yes,
Okay.
that's right.
Okay, here, let's get to our questions. Josephine from Raleigh, have lots of congestion and cough all night. What should I do to help?
If they're not already taking any over-the-counter allergy medications, they could obviously try that. But if they've already run that route, a consultation to make sure what's actually causing the cough. Those symptoms could even be caused by acid reflux disease. It may not be an allergy at all.
Wow.
And so an evaluation in a physician's office would be very appropriate with appropriate testing based on the history.
Okay, this is from Renee. Do allergies affect vocal cords and taste buds?
Sure. Mucus production can change a lot of things. First of all, a lot of drainage can accumulate in your throat and can affect the quality of your voice. A lot of patients I have are singers and are very bothered by allergies because it changes the pitch of their voice.
Oh, wow.
Taste buds as well. I mean, if your sense of smell is altered, which a lot of congestion does do, it changes the way you taste food.
Sure.
Okay. Kesha from Scotland Neck has large amounts of mucus, had the problem for over 10 years. It's not associated with any pain, but just large amounts of mucus. What can she do? Or is that a problem? Should she go get evaluated?
Yeah, I mean, certainly, again, if they're tried over-the-counter measures, Mucinex is, again, a commonly over-the-counter drug that can help thin mucus. But again, making sure that whether there's an allergic phenomenon that's driving the mucus is an important thing to, again, evaluate, rule out, and make the right steps in that regard.
And nasal saline irrigation can help a lot with nasal congestion as well. You get these what are called neti pots.
Oh yeah, the neti
you can
pot.
do. Yeah, well, there's a squeeze bottle version, which is a lot easier to use than that.
And
that
probably
works
a little
quite
more
well.
attractive than dipping your head over the
That's
sink like that. But I do those and they're good. Julie from Raleigh, over-the-counter meds for sinus problems are not helping. What should she try next?
Well, and they, I think, as Dr. Jones said, if you get evaluated and if your symptoms are caused by allergies, an intranasal steroid can help a lot. And that is, there's one actually now that is over the counter, but most of them are by prescription. And that would be very much more effective.
So tell me, at what point allergies become, someone that suffers from allergies becomes a surgical candidate? I mean,
Again, that would be based on chronic infections. And so a patient develops chronic sinus infections or recurrent sinus infections at a level of a frequency of 3 or 4 infections per year, or infections that last 3 and 4 months at a time. They should have a surgical evaluation, which again routinely includes an allergy workup in that workup if they've not had that prior to presenting.
I had that sinus surgery and my life was changed. That's my testimonial for today. This is Karen from Raleigh. She takes Nasacort and Claritin, has for the last 2 weeks, still having sinus pain and pressure. How long should she continue before expecting to see results, or should she try something else at this point?
Well, at 2 weeks, I think it could still be an infection. So if it doesn't get better in another week or so, I would think that probably she needs to be seen.
Okay. This is Jacqueline from Chapel Hill. Sinusitis. Notice she gets a sinus headache when she drinks cow's milk. She just noticed this as she's gotten older. Could this be possible from an allergic reaction to cow's milk?
Absolutely. I mean, again, you can develop adult allergies of any type that your immune system does change. And so, again, eliminating milk and seeing if that truly eliminates the headache is the first step that I would do.
Is that true that if you're drinking milk, it causes more congestion?
So that's, we don't understand the medical or the pathophysiologic basis for that or why that happens, but that's something a lot of my patients will say, that when they drink milk, they feel that the amount of mucus they produce increases. So that could be behind that increased sinus congestion as well.
Okay, Teresa from Apex has or a question about the drops underneath the tongue. First of all, wants to know who does that. He does. And is that suitable for an 8-year-old?
Yes.
Okay. And what sort of things are you treating? I mean, we know the grasses. We just saw a tablet, but what about the drops?
With the drops, again, we use that basically the same way that you would use standard immunotherapy shots. So we can treat any antigen the same way. That antigen, instead of being introduced under your skin, is going to be introduced into your bloodstream under your tongue.
Okay. And you do that for how long?
Well, all immunotherapy regimens, again, run for years, so that
Okay.
it's a several-year process to go through being desensitized in order to see the long-term benefits of truly staying desensitized.
Okay.
And so it would be a long-term therapy for, again, long-term benefit.
Okay. We're back after the break to answer more of your questions. Give us a call or send us an email. This is Rex on Call. Welcome back to Rex on Call here live on WRAL. To reach us, call one of those numbers at the bottom of your screen right there, or you can email us your question to rexoncall@rexhealth.com. Now, we're going to get to some questions here. Pam from Stanford, have there been any breakthrough or advances in the field of food allergies?
Well, food allergy is a hot topic. So many people are being diagnosed with it. Unfortunately, there's no current therapy for it. There are therapies under investigation, and at UNC, we have a big group that's studying oral immunotherapy, so treating food allergies via mouth, but it's still being studied and it's not available for clinical use.
Okay. Jackie from Wake County gets bad headaches at night and is congested in the morning. Is there such thing as night allergies?
The antigen there is most likely a dust mite, that you're exposed to a large amount of dust from fabrics and pillowcases and the like. And so the fact that she gets so symptomatic at that time, I'd be very curious to see if she was positive for a dust mite allergy.
And you can't exactly escape a dust mite allergy. I mean, it seems like that's something that's everywhere. What do you do?
Well, dust mites are everywhere, but there are encasings you can buy, allergy covers that remove them, zip them up and keep them away from your nose so that you're no longer exposed to the allergen. You can wash your sheets in hot water. So there are environmental measures you can use to minimize your exposure.
Anybody else feeling congested just talking about all of this? From Twitter, is it true that buying local honey can improve allergies?
So that would be along the lines of the sublingual immunotherapy. You know, local honey is produced by bees that are flying around, rubbing their bodies on plants that are covered with pollen, and then that gets put into the honey. So when you're eating the honey, you're actually eating that pollen. So it's sort of analogous to the under the tongue treatment. So, you know, it hasn't been studied, but it certainly anecdotally seems to help.
Is that something that you recommend for your patients?
Sure.
Yeah.
Eating local is always good.
Absolutely. Marilyn, a 5-year-old granddaughter with severe allergies. She's actually getting allergy shots once a week right now. Is there something that goes under the tongue that would help? We kind of talked a little bit about this. So she would be at age 5 eligible for sublingual drops?
She would be a candidate to undergo that therapy.
Okay. If you're allergic to peanuts, should you eat things cooked in peanut oil?
So this is a question I get all the time because Chick-fil-A fries their fries in peanut oil. A lot of people who are allergic to peanuts think they can't eat there. So commercially produced peanut oil is produced in such a way that it contains none of the peanut protein, and that's what you're actually allergic to is peanut protein. So it's fine to eat foods that are fried in commercial peanut oil.
Oh, good to know. Iris from Raleigh, a tickly thing inside her throat, constant sneezing spells, lots of coughing. Could this be asthma? Or does this sound like traditional allergies?
So coughing is a symptom of asthma, and that's something that I think patients do need to be aware of, that, you know, coughing can represent postnasal drip, but it can also represent undiagnosed asthma, so absolutely should be taken seriously.
Yeah, she needs an evaluation
Yeah.
to see what.
Okay. Okay, if you're looking for a doctor or need a direct referral, you can call Rex Health Net, Rex free telephone information service. The number is 919-744-4490. Not to be confused with our phone number here at the show. We're going to have another round of questions after the break. Stay with us. This is Rex on Call. Welcome back. This is Rex on Call. We have a lot of questions to get through, so let's get to it. This is from Raleigh. Every spring and fall, I get a rash behind my knees and the crooks of my arms. Could this be related to allergies?
So it sounds like eczema or atopic dermatitis, which is part of the spectrum of allergic disorders, so it certainly could be exacerbated by allergies.
Okay.
Sure.
Kay wants to find what's the best way to find out what you're allergic to?
Allergy testing.
So what's involved in that?
With skin testing, you're introduced to these different antigens, and a wheel and flare reaction is measured.
Okay. Female, Vicky, who has nasal polyps on both sides. How does she relieve this?
Nasal polyps can be difficult. They often don't respond to any sort of medical therapy. You can try high-dose steroids and sometimes shrink them, but oftentimes they need surgical intervention to correct that.
Okay, Mike says his son is 6 and is having a really dry cough and frequent nosebleeds. Is this allergy related?
So a cough certainly can be. Again, it could represent asthma. It could be postnasal drip from the mucus running down the back of his throat. And nosebleeds do actually result from bad inflammation in the nose due to allergies, so it could represent allergies.
Or chronic sinus infection may set in as well.
Needs to get in front of a doctor. This is Margaret. She used to get allergy shots, and it helped significantly. Is it possible to relapse when she stopped with injections?
Absolutely.
Yes.
Yes, and especially the way we used to do it in the past, where the doses were a little bit weaker. I think relapses were more common. So yes, it could be, and she could be retested and restarted now.
So, I mean, you're saying it's sometimes years before you realize you build up that immunity to the allergy. So are you cured at that point, in theory?
So our approach is, it's years till you build up the immunity, but the symptom relief comes pretty quickly. So you don't have to wait years to see the benefit.
Okay.
But for it to be a lasting benefit, you have to do several years worth of therapy. And in theory, at the end of that, you're cured.
Okay. Contact dermatitis, is that related to an allergy or is it just a rash?
I mean, it is a type of allergic reaction.
Okay. So in theory.
It is. It's just it's not the same mechanism by which you get the coughing, runny nose, sneezing, but it is a cell-mediated immunity is what we call it, an immune reaction.
Question from Durham. What over-the-counter meds do you recommend to help stop that postnasal drip? Any favorites?
I mean, I would probably go for the nasal steroid as being the most potent thing that they could try. The Nasacort AQ is the only one available over the counter right now.
And the rest are by prescription.
Okay, and then the Afrin, we have to say, you can get addicted to that stuff, right?
Absolutely. You should never use
That's
it for
not a
more
good
than
choice.
2 to 3 days at a time. So it's only good for acute therapy, like in the setting of a infection where your nose is stuffed.
Okay, what causes that tickling feeling of the throat with an allergy? What causes that?
It could be postnasal drip, which causes tickling, and then also you have the same cells on your skin that cause itching. You have them in your throat, and so exposure to the pollen can cause your throat to itch the same way.
Good to know. So allergic to corn and soy. What can is there anything orally that they can take to minimize the symptoms?
No, unfortunately with true food allergy, one is to have that evaluated to make sure it's real, but with true food allergy, the only treatment is strict avoidance.
Okay. Having allergies that have caused a sinus infection and laryngitis, is that normal for allergies to turn into an infection?
They certainly can frequently, especially again if you undertreat them or ignore them.
Okay. Last question. There's a large amount of mucus every morning. Are mornings the worst time for allergies?
So that goes back again to the dust mite issue. I think lying in bed for 6 to 8 hours, inhaling the dust mite allergen all night, you often wake up congested.
Okay. So good stuff. Okay. As always, consult with your physician about any health concerns. Thank you guys for coming in to answering our questions. And to the phone bank that is still taking calls over there, be sure to join us on May 19th for our next Rex on Call. The topic, orthopedic injury prevention and treatment. We'll hear from last year's Rex Open champ Chesson Hadley about life on the PGA Tour and how he stays injury-free. Again, that's May 19th. You can email us ahead of time with your orthopedic injury questions. Use Rex on Call at rexhealth.com. We'll see you next time. Thanks so much for joining us.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.